So what's going on at Arrowhead that's a little different?
We're still fully operational as far as our inpatient unit. So our 48 inpatient beds are still available, full access 24/7 for those. I guess the only difference on that is a little more heightened health screening on the front end. Just to take a look at individual symptoms and all, and if any of them are exhibiting any virus type symptoms, then we're going to refer them to be taken a look at medically. On our outpatient basis, we are moving more virtual for our groups. So the last 2 days, our partial hospitalization groups have been done remotely through Zoom. Our intensive outpatient groups, I believe, are transitioning to that tomorrow. Up until this week, we had been still holding those groups in the building, utilizing space in the gym, so we can spread out a little bit more, adhering to that social distancing. And, as those groups grow, it's kind of hard to be 6 feet apart. So we have transitioned more to the remote virtual meetings. But otherwise, like I said, inpatient-wise, we're business as usual.
So how's Zoom working out for you guys?
That is a very good question. Like I said, we're day 2, so I did hear our therapist in the hallway saying that things are going well, and they just took a break for everybody to go wash their hands. So we're still trying to do some of those measures as well. But I think it's going well so far. It's our first go around with this, so I'm sure that there will be some hiccups, and at least we're getting people together and they're able to continue with their treatment.
Okay. So what would you like folks to know? I'm hearing that your inpatient unit is still operating. Your clinicians are moving to telehealth via Zoom. What else would you like folks to know?
I think that's really the biggest thing. I mean, we're doing the best that we can to stay safe and still provide the care for folks in our community that need it. As this continues, we're going to see more and more, especially from your vantage point too, the mental health issues are going to continue to spike. So I think it's really important that community members, that we all collaborate and work together and are available for folks at this time. So I know that we're doing everything that we can to remain open and available for them. I think that's the biggest key. A lot of agencies in the surrounding areas are going to alternative measures. As much as we can remain face to face, I think is beneficial for those individuals. But as the landscape that we're dealing with changes daily, we're going to have to adjust. So I think the biggest key is that we're open and we're available.
Yeah, echo that sentiment. So how many people are working right now?
We're pretty fully staffed. All of our physicians and our nursing and intake staff, business development, we have been remote from home some. This week we've worked more internally. Every day it's changing a little bit. I think that, we're trying to pitch in wherever we can to help inside the facility. Although we're not clinical, we can sanitize, doorknobs and different things as well. So however we can help. So we're utilizing staff in various areas that we're not necessarily used to. But in order to be able to remain viable and accessible to our community is what we're going to do. If we were to get any individual that contracts this virus, who knows what takes place. We're spending some extra time making sure that the facility's safe for everybody that enters. Everyone's entering just through the front door and being screened on the front end. And anybody that has any elevated fever, we're taking extra precautions. So safety at this time is I think our biggest concern.
Are you guys seeing an increase or a decrease in folks utilizing services?
Last week, we actually had an uptick in call inquiries. Our outpatient units actually filled up. We stayed pretty steady in our inpatient unit. Things have actually slowed down a little bit so far this week. I think people are realizing and maybe actually following our leaders' stance on staying home. So yeah, we've seen a little dip in the need or the calls this week. Like I said, last week kind of remained the same, actually had a little uptick.
Okay. Is the situation affecting no-show rates?
I don't think it has affected that at all, no.
Okay.
I think we're seeing,
That's
folks
good to
have
hear.
actually, last week they were coming to group. I mean, we had more of a problem that we had too many people here than people not showing up. And from what little bit I've heard with the Zoom, people are checking in and they're actually participating remotely. So not a problem with so far.
Good. Well, I don't have any other questions. Do you guys have any other questions?
I don't think so. Just good to kind of hear what everyone's doing, and it seems like everything, as much precautions, but at the same time, got to make sure people who need care are getting it. So sounds really good.
Is there anything else that you wanted to share, Phil?
No, I think we're good. Like I said, the biggest key is that we're open and we're available. So call us.
All righty.